Hi, my name is Nicole MacLeod, Registered Psychotherapist. Building what we call the therapeutic alliance, a relationship where a patient feels comfortable with a therapist and feels that they can be themselves and feel comfortable and vulnerable. That's really important. I really try to let patients know that they aren't alone in what they're experiencing, to normalize what they're going through, to let them know some of the difficulties I've been through or areas that I've struggled with. Letting my patients know that I have ADHD is really helpful because they say, oh, okay, you get it. You understand. And when you are able to connect with a patient and say, I've had a similar experience and this is what helps me, you can say, I understand why you're doing that. And I used to do that too. Then they say, oh, obviously you found a way to get through it. So tell me about it. Like then they're interested, and that's helpful to people. This is a, judgment free zone, and I am genuinely dedicated to helping people. Some of the techniques that I like to use is what we call unconditional positive regard. So for a lot of people, there's a lot of guilt and shame and fear around the experiences that they've gone through, especially if there's been trauma or abuse, whether they've experienced or been a part of. And I think when you let people know, I'm not judgmental, I'm here to support you, I'm here to uphold you and help you identify your areas of strength. A lot of people, they come to you with a problem and they think this is so big and overwhelming and all I can see is my problem, that they sometimes forget about some of the strengths that they have as well. And when you start to help people identify them, then they get excited and they say, oh yeah, I've got some skills. I've got, arrows in my quiver that will help me tackle this problem. My role as a therapist is to help my patients learn how to help themselves. When you learn the method and you learn how to break down negative thoughts, that's step one. When you have done so automatically and you're coming back to session and you're telling me, oh, this thing happened and this trigger came up that used to bother me, but I reframed it right away and I thought of a better way to think of it. I recognized my negative thought here. I was able to decrease some of the negative feelings I had. That's step two, because now you're doing it automatically. And step three is when you're telling me that you've started to teach other people around you how to do it, maybe your friends or family. So it's not so much about me helping as it is me helping you help yourself, me helping you identify areas of strength, areas of difficulty, me helping you create goals to live the type of life that you'd like to live.